Hi there, and welcome to another success story. We have a consultant psychiatrist today, the lovely Rachel Brown. Hello, nice to meet you.
Hi, Stephen. Nice to meet you.
I always start with the same question. How did you become carnivore?
Yeah, so I've been carnivore for just over 3.5 years now. So it'll be 4 years come July of this year. I kind of dove into carnivore purely out of curiosity. But there's a bit of a backstory to that, as there always is. So I mean, I've been immersed in the low carb way of eating for probably the last 20 odd years. So Atkins, when that kind of surged in popularity, I think probably in the early 2000s, just off the top of my head. And I kind of fell in and out of that for a while, and I never really knew why until fast forward to 3.5 years ago when I went carnivore, and then everything became very clear to me. So anyway, so going back, did Atkins on and off for a while. I've been a huge fan of Mark Sisson for many years, so following Mark's Daily Apple. So I love all of his ancestral approach to health and just all of the articles and information that he's put out over the years. However, I also felt over the years that I possibly had an emotional eating type issue. And so I had times when I veered away from strict low carb and then did more in the way of intuitive eating, and then allowing yourself to eat anything that you want, as long as you're doing it intuitively. And about 6-7 years ago now, I decided to go fully ketogenic. So I'd been following Mark Sisson's kind of protocol where I was low carb, but not necessarily very, very low carb, for quite a number of years, and probably the last 10. And there was some illness in my family that made me really think seriously about a ketogenic diet, and for all the benefits that can have, particularly in relation to neurodegenerative type illnesses, but also a lot of other chronic illnesses. So I went keto, and then it was just a popular keto influencer and podcaster who introduced me to carnivore. So it was Vanessa Spina, or Ketogenic Girl. And I think she was doing her own carnivore experiment one day, and I remember seeing an Instagram post of one of her meals and thinking, what on earth is she doing? That sounds absolutely crazy. And she explained a bit about doing a carnivore experiment, and I'd just never heard of carnivore at that point in time. So I went on YouTube, listened to Michaela Peterson speak at CarnivoryCon, telling her whole story about all of her health recovery, using carnivore, or more of a lion diet, as she calls it. And then I watched one other lecture by Sean Baker at CarnivoryCon, and that was the one where he had the analogy about the state of nutritional research and flying on a very dysfunctional, broken plane. And I can't really do his analogy any justice, but if anyone is interested and hasn't watched that already, I think it's well worth a watch. And so it was just after watching those two people speak, it made a lot of sense to me, even though it sounded crazy a couple of days before. And I tend to be a bit of an abstainer, so can be a bit impulsive, but I basically just threw myself into it and thought, I'm going to do this purely out of curiosity, because I'd really like to know more about what this is all about. And I didn't really think that I had any major health issues at the time of doing that. So there wasn't really a major health reason as to why I decided to try carnivore. But I've had lots of health benefits as a result, and that's why I stuck with it. And one of the biggest ones, just to, I suppose, try to make a bit of sense of what I've said so far, is that it turns out I didn't have an emotional eating issue at all. It was really just sugar addiction all that time. And I think I'd had an idea about that when I was keto, and keto helped a lot with that, but it wasn't a completely freeing sort of way of eating, unlike carnivore. So I still had a couple of foods where I was maybe a bit more compulsive around, or felt just a bit more out of control around, and that was nut butters and dark chocolate, those kind of foods. And carnivore has just brought a whole new level of satiety and a completely different relationship with food and food freedom. I hear a lot of people talking about, and I know exactly what that means now.
Yes, and that's one of the things I discovered fully. I've been carnivore 3.5 years, and I only really discovered the food freedom year and a half ago.
Oh,
So
wow.
yeah,
Okay.
it's crazy, isn't it? So how long have you been a psychiatrist?
So I graduated from university 2003 and then went straight into psychiatry 2004 after doing the first year that you have to do in medicine and surgery back then. So
Was there any link when you were training between your job and nutrition?
no, nothing, absolutely zilch. I don't even remember anything, to be honest, at university. So I know I've listened to lots and lots of podcasts by this point in time. And I know some people talk about you only get 5 hours or 20 hours at medical school. I don't personally remember any. I joked with somebody else that perhaps those were the days that I skipped class and I didn't go, but something tells me it wasn't that.
So how was your new knowledge regarding nutrition, which you found out through your own experience? Has that impacted on practice?
It has now, definitely. So 2 years ago, so early 2021, I managed to train with Dr. Georgia Eade. So I went on her ketogenic diets for clinicians training course. And when I first found out about that, that was just music to my ears. So I don't think I've ever been so excited to do a piece of continuous professional development than going on that course with her. And that was really amazing, just to hear from a very experienced clinician who's been using nutritional approaches and metabolic approaches to mental health for a very long time now.
And what changes have you seen in your practice since you've been adopting these sort of methods?
Yeah, so it's a bit difficult where I work. So I work in a crisis service in Edinburgh, and we tend to have only very short-term contact with people. So I might only see a patient once or twice during their time with the service. And I remember Georgia speaking about that and how difficult that might actually be for me to implement these changes in a big way in my practice. So for a lot of the time, I tend to just approach people by giving them information and by trying to make the link between the importance of metabolic health and your mental health. And it's not always entirely appropriate. So some of the people I see are acutely suicidal or very psychotic, or too unwell to really be able to retain information that way. But there are definitely others who it's possible to sow the seed, who then go on to look into making a dietary change at a later time when things are a bit more stable. However, having said that, I sat on my training for a while because I was acutely aware that the field of metabolic psychiatry is extremely different to the rest of mainstream psychiatry and is not yet widely accepted, or even I don't think most psychiatrists are aware that diet can have a huge impact on mental health. So I wanted a bit of time after I trained with Georgia just to let the teaching and her knowledge bed in, and to also think about how was I going to be able to take this forward within my own career and practice. And that's really why last year I decided to write a book on the subject. And so I ended up publishing a book July of 2022 all about metabolic health and mental disorder, because I really wanted to make sure that I had a firm grasp of the research literature and the different links that exist in relation to all the different bodily systems and the brain. But so more recently, I have been speaking a lot more with patients that I see. And I did some recent teaching for the team that I work with, which was good timing, because I think a lot of them have been wondering what's happened to me, because suddenly patients are talking about diet with them and they don't know exactly what I know in relation to ketogenic diets and the positive impact that can have in terms of mental health disorders. But having said that, just very recently, my practice has changed in that I've been actively trying to do blood tests to look at measures of insulin resistance for patients. I found a fair bit of insulin resistance in the people that have had blood tests so far. And I've had one person very recently who'd struggled for a long time. So they'd been with our service for quite a number of months, really struggling with a bipolar illness. And they're the first person who I've been able to have a longer period of contact with. And they've managed to transition to a ketogenic diet, and there was quite a significant improvement in their mental health. within the first 2 weeks of doing that. So that's really exciting.
Yeah, that's very exciting. Now, I'm not asking you for a science lesson, but just sort of very basically, why do you think this way of eating is beneficial? What's the basic mechanism you think what's happening?
Gosh, there are quite a number of different mechanisms, so
Yes.
I'll try to keep it brief if I can. I mean, gut health is huge. So I should say that I trained in functional medicine in the last couple of years, as well as being an allopathic doctor. So that's given me a new appreciation of just the body as a whole and approaching things holistically, and thinking about how all the bodily systems work together and shouldn't necessarily be split up into silos of different specialties. But we have the gut-brain axis, so we have clear connections between the gut and the brain, and there's the vagus nerve in between, but there's chemical signaling, so using hormonal methods and the immune system, and the gut influences the brain and the brain influences the gut, and vice versa. So from just a very simplistic perspective, the first thing I often think about is leaky gut or increased intestinal permeability. And what often comes to mind is gluten or gliadin, a component of gluten that causes the tight junctions in your gut cell wall to open up and allow, I don't want to get too technical, but lipopolysaccharides and other kind of antigenic immune stimulating particles to get through from your gut into your bloodstream. And then this sets off a whole cascade of immune system activation, including some of the immune cells in your brain, which leads to neuroinflammation. But you also get inflammation and oxidative stress all in the mix there. So there are various different mechanisms. We do know that in certain conditions, particularly Alzheimer's disease, there are brain energy deficits. So you get cerebral glucose hypometabolism, or just sluggish brain metabolism, and insulin resistance plays a part in that. So you end up with a brain that's swimming in glucose, but if you're insulin resistant, the insulin doesn't work and your brain cells can't access the energy that they need. And that's where the beauty of the ketogenic diet comes in, because if you're able to switch your metabolism over to running on ketones instead of glucose, then ketones can cross the blood-brain barrier and fuel your brain even when you're insulin resistant and the insulin's not working as it should.
It is fascinating, and actually I think people are interested in the science. So you did well there. I think that's brilliant. And interesting, because allopathic and also functional, you've got the best of both worlds there. Mm-hmm. Do you feel that since you've learned about nutrition, your use of medications has reduced? And has that happened a lot?
Yeah, I would love to say yes to that. Sitting in the crisis service, there's a massive pressure on us to not admit people to hospital, because like everywhere, there are huge pressures on beds, and often the hospital is very full. So I would say historically, we've tended to be fairly aggressive in our medication use for people. And I can see benefits to that, because we definitely can get people's illnesses turned around in the acute phase and let them recover. But for me, it's my main concern in psychiatry is just about the longer term health outcomes for people. And if people end up staying on medications that can negatively impact their metabolic health, that's a significant concern for me. And there are certainly many medications that we use that do impact negatively on metabolic health, particularly some of the more modern antipsychotic drugs that can cause weight gain and insulin resistance, and ultimately type 2 diabetes and obesity for people.
But you're in a role where you've got to stabilize someone pretty rapidly. So giving the mistake's not going to work, is it? I mean,
no,
not going to work at all.
No, I know. And do you know, the frustrating thing about it is that I know from what I've seen, but I also know from Dr. Georgia Eade's practice and many people that I've spoken to who have used diet and nutrition to improve their mental health disorder, that improvements can happen really quickly. And for some people with major mental disorder, it can be as quick within 2 or 3 weeks, for example. And but it's just frustrating that sometimes we're seeing people and there's so much risk involved in their situation at that time that it just wouldn't be feasible to be able to keep them at home and kind of wait for the transition to take place without using medications as adjuncts.
And do you get involved in explanations to the patients that want to know? I mean, do you start talking about dopamine and serotonin and GABA and all those sort of things to your patients
on a routine basis? Do you mean just kind of routinely?
Yeah. Do people get involved in their own brain chemistry?
I don't personally talk much about brain chemistry because I'm wondering if that's a leading question there.
No.
But yeah, I think there's been so much focus on neurotransmitters for decades, and I think they're only one small piece of the puzzle. So we know when your body's in a state of inflammation, and inflammation sometimes refers to immune system activation and also oxidative stress. We know that there's certain neurotransmitter pathways that can be tipped out of balance. So we know, for example, the tryptophan pathway is the one that we often think of first, or the kynurenine pathway, as it's called, and you can end up having too much glutamate produced and not enough GABA. So the glutamate's the excitatory neurotransmitter, and GABA being the more relaxation inhibitory neurotransmitter. And we know that in states of inflammation, you can end up having up to 100 times more glutamate than you actually should. And we know that this drives further immune system activation within the brain and neuroinflammation. And so that's I think where some of the neurotransmitter theories do fit in. But as far as serotonin and depression, not so, I'm not so convinced about that.
I was just asking that because I'm a specialist practitioner in obesity and diabetes, and a lot of influence has happened, and people are now much more interested in, well, why has that happened? Why has my blood glucose gone up? They ask me those sort of questions. I actually want to know, but I just wondered in your field whether that was something you were seeing, but obviously not. And I would imagine that's because we're talking about brain functioning in the first place, aren't we? So probably thinking clearly and wanting to be logical is not really on that list, I would imagine. So what do you feel is the future for psychiatry? Do you feel that nutrition will become part of it, or do you just think it's the same as everywhere else, that the mainstream really is just not interested?
Yeah, that's a tough one. So there are various trials ongoing at the moment. So I've been lucky to have involvement with a trial in Edinburgh looking at the ketogenic diet in bipolar disorder. And that was a pilot study with a view to doing a larger trial, hopefully later this year. And meanwhile, there have been trials at Stanford and also in Australia as well on variations of that theme. I know there's a big drive, and there is progress being made in the research field in terms of trying to get the randomized controlled trials that some people will feel they need before they even give it a second thought, that nutrition might have a role to play in terms of mental health. And I'm hopeful that those studies will come. I'm fairly confident they will give good results, because at the moment we know there are many people in the real world who have been having a lot of success with this kind of nutritional ketosis approach to major mental disorders. And I personally have been in contact with quite a number of people with all sorts of different diagnoses who've really managed to improve their mental health. Probably more in the carnivore field, but that's just because those are the meetings that I frequent, but also know of others who have used a ketogenic approach to improve their mental health. I say it's a difficult question because I can't say this without sighing, but just the influence of corporations and the pharmaceutical industry. So I think a lot of medical education, or certainly the way I was trained in allopathic medicine, it was make a diagnosis and then use drugs X, Y, and Z to treat. And I have to assume that there's a fair bit of influence that happens there in undergraduate medical training. So I don't really know how holistic Western medicine is, and certainly having qualified in functional medicine, when I put that hat on, I would say that Western medicine is very good at the acute illnesses, but when it comes to chronic ongoing conditions, then that's where it can really fall down. So it feels like it's a grassroots movement at the moment, albeit with some research developing. I'd like to be hopeful that it will be an option in the future. I'm certainly going to do whatever I can to try to develop some services within the NHS if that's possible, and out with the NHS if I come up against closed doors along the way. And so that's where I'm at.
Yes, you mentioned that you make a diagnosis there. You were talking about your training. So how do you, in your situation, how do you approach making a diagnosis, and how do you sort of create a treatment plan for a patient when you're under that much sort of time pressure?
Yeah, so in crisis and home treatment, we're probably under slightly less time pressure, I would say, as a psychiatrist, as opposed to psychiatrists who might have chock full clinics of patients. So I find that people in crisis naturally require a longer period of assessment. And by longer, I mean a standard new patient. If you go to see a psychiatrist in the NHS, you'd be allocated 1 hour for an appointment. In the crisis service, it's not uncommon for us to be there for 1.5 hours, sometimes 2 hours. It just very much depends on the person's individual situation. It's obviously a lot about the psychiatric interview that you conduct, but also about their past medical history and any other history that you might be aware of, just taking that into account, and also about family history. So there's been a lot of emphasis placed on family history in my training and genetics, whereas now where I am at the stage of my career, I actually think it's epigenetics that are more important than genetics. And I'm acutely aware that our diagnoses are essentially artificial constructs. So we're grouping together symptoms, and there can be a lot of overlap between different diagnoses, and also disagreement between clinicians about what particular diagnosis somebody may have.
Yes, the labeling of people, and it's fascinating because I'm in a position where, and I only had it this week, a couple of people, I said, you are sort of diabetic. You don't know you're diabetic. You've just told me all the symptoms of being diabetic. But I don't like that labeling because I know that can be reversed.
Mm-hmm. Yeah.
So it's just a thing to hang your hat on for a bit. But I just said I wouldn't worry about it. And we've got a long-term plan, and I see a lot of resolution of that. So let's lighten it up a bit, because I think that was getting,
it does get very serious, doesn't it? Yeah.
But the thing is, I pride myself on trying to be really open and listen to people that, are in a completely different role. Mm-hmm. Although we've got that common theme that nutrition is helpful, obviously your patients are different to the people I see. So it's just interesting how you construct your way of working. So, everyone always asks me if I don't ask this question. They always put it in the comments. Your day of eating, just you as a carnivore, what is your meal frequency, and how does your day go as a carnivore?
Yeah, so for a long time, I was doing intermittent fasting, and I was doing that when I was keto. And then when I transitioned to carnivore, I just found it so much easier to fast. It was less forced. And I stuck with 2 meals a day within it kind of naturally fell to a 6 or 7 hour eating window. So it was fairly narrow. More recently, I've become more interested in circadian rhythms and circadian health. And I've been deliberately not doing intermittent fasting. So I've been going more to 3 smaller meals per day, eating within a 12-hour or 11 or 12-hour eating window. I'm still not entirely decided what I'm going to do. I'm kind of just doing my N of 1 experiment to see what best suits me. I've had some thoughts about, will I go back to 2 meals but do breakfast and dinner and just have fasting during the day without having that more prolonged fasting period. But I'm just not sure about how much I'll manage to eat in the mornings for breakfast. That might scupper that plan. And I tend, over time, it's gravitated towards a ruminant red meat diet primarily. So mostly beef, some lamb, I do eat some bacon. I include some egg yolks and ghee in my diet. I can't do egg whites, and that's been the other thing that carnivore has been great for, is just narrowing down food intolerances. It makes it very clear and very obvious what issues you may have. And I try to do some oily fish now and again, but only really when I feel like it. So that's pretty much what I do. And I probably have, I don't know if people want amounts, but I remember when I started off doing carnivore, it was quite a thought when you were listening to Sean Baker about what the average person might need to eat in terms of pounds of meat or grams. And I really struggled in the beginning to eat enough, but that's not really any problem now. So I'm probably about 1.5 pounds of meat or thereabouts, I would say, in a day.
What about drinks? Do you have tea, coffee, or do you stick to just water?
No, so I have water. Coffee's been a bit of an addiction, I would say, as well, that I gave up for a while, and I've given up properly now. I might have the very odd occasional decaf, but kind of more of it's just more of a positive association if I'm out somewhere. But I try not to do that very often, because I'm one of the people where coffee increases my triglycerides. So I did some blood testing and found that out after I've been carnivore for a while. So probably in the first year, I did some lipids and found that my triglyceride to HDL ratio wasn't quite where I wanted it to be, and I wondered why. So then I kind of dove into Dave Feldman's work, gave up coffee, retested, and my ratio dropped quite dramatically.
So when you do the blood tests, in your field, what are the normal tests that you would do? What would you be looking for?
In psychiatry, so probably you do a bit of a screening set of bloods. So you would do a fasting glucose, and particularly if you're thinking about starting somebody on an antipsychotic medication, because you want a baseline to know, to compare what happens subsequently. You might do fasting lipids, but not necessarily. It would be more if you're going to start a medication, you would do that. And then you would just do screening tests for sometimes B12 and folate, not necessarily all the time, thyroid function, liver tests, kidney, and a full blood count to check about infection or anemia. But I have to say, I don't know that we're all that good at doing all of those tests routinely. So I don't think everyone who passes over the psychiatrist threshold necessarily always gets those tests. I think we could do that better.
And does your role involve addiction? I mean, is that one of the big things that's happening?
No, so I've never worked within addiction psychiatry, so there is a subspecialty in its own right that deals with all of that. Although obviously people that come through the service I work in, it can be quite common for people to have comorbid addictions, as well as whatever other mental illness that they have or mental disorder they're dealing with. So I deal with it in the periphery, but I wouldn't necessarily, if somebody had quite a complex dependence to drugs or alcohol, we wouldn't be the first port of call for treating that. So we would call on colleagues for their expertise.
But I want to go back to something you said there about circadian rhythms. Yeah. What's made you consider that as very important?
Well, there's a fair bit of research in terms of mental disorder about the importance of circadian rhythms, and most things that people complain about to me does tend to be sleep. And I'm just kind of troubleshooting my own kind of personal state of health, and just really out of curiosity to see, because I think I live quite a high stress life and career, and so a lot of it comes from wanting to manage stress optimally. So I've been trying out grounding or earthing, and really I'm absolutely fascinated by the field of quantum biology. So I have a friend who I've been speaking to who's very knowledgeable in that field, and that's something that I'm yet to dive into properly, but I really do want to learn more about, and I think could be extremely helpful as a psychiatrist to know more about that side of science.
Yes, I mean I bought a grounding sheet this year to try that out, and a meter to make sure that we got rid of the grass last year in the garden, so we paved it all, but it's still suitable for grounding, so that's really good. But I think that I absolutely agree with you. I think it's underestimated, circadian rhythms. Our raw carnivore dog, who doesn't know anything about time, knows when to go to bed, and he will sit and say, it's time to go to bed. And in the summer, it's 9:15 roundabout, and in the winter, it's 8 o'clock. That's it. And we just let him do it. You know, and I do think as a carnivore dog, he seems to be better at that sort of thing than dogs that maybe are fed not so good stuff, if you know what I mean. You know, like so I think that we could learn a lot from animals, because they seem to know a lot more about nature than we do. We're definitely disconnected from it, and I think you're right to look at that.
Yeah, I mean, actually, I've got a story about carnivore dogs, because I have 2 dogs at the moment. One's very old. I don't know how much longer we're going to have her, but she's actually gotten to a ripe old age for her breed size, and she had horrific autoimmune illnesses when she was young. And actually, a lot of my interest in holistic health and natural health treatments, I think, has come from her health journey. So she was paralyzed when she was 3 with a very rare autoimmune disorder. And I had to really fight to get some experimental treatment to get her better, because it was so rare that there weren't really any specialists locally or in the big veterinary hospital in Glasgow who knew the optimal way of treating. And it's been really nice over the years to find holistic vets. So I'm a huge fan of holistic veterinary care, which aligns very neatly with functional medicine, in my view. So they tend to take a similar approach. And over the years, because this dog had been on chemotherapy and had been very immunosuppressed when we were having her treated, back when she was paralyzed, I thought about using a raw food diet for her, because I hadn't been doing that up until that point, but just really worried about the immunosuppression, and then also was very anxious about her health in general, because she's been a very sensitive dog and is easily knocked off in terms of her gastrointestinal system. And eventually I transitioned her to raw when she was fairly old. I forget exactly, but she was probably about 8 or 9, possibly even 10. And it was just the best thing that I ever did for her. And that's completely changed my approach. So the younger one's been raw fed from the get-go, and that's 80-10-10 for anyone who raw feeds, so 10% bone, 10% organs, 80% everything else, muscle meat. And I don't routinely include veg or fruit or anything like that in their diets. And something I really reflected on was that my older dog with all the health issues has always been the fussiest eater ever. And it dawned on me when I gave her raw food that actually she probably just knew all along what it was that she would eat, because she would never touch a single piece of food that had any sort of vegetable in it or fruit, like nothing.
They are so much smarter than us, aren't they?
Yeah, absolutely.
So that brings me on to a couple of questions, which I always like to ask about, because when people go carnivore, there's a pushback. So firstly, what about your colleagues? Do they know what you're doing? And if so, do you get some pushback and some strange remarks from them?
Yeah, so a lot of the team that I work with are nursing staff, some support workers, psychologists, different disciplines that work in the team. I'd say most people know that I'm carnivore, but possibly not all. They do talk about, I know that they talk about other people within them, amongst themselves, because I hear it sometimes. So I'm sure probably more know than I've spoken to directly about it. My consultant colleagues, though, I don't particularly work that closely with. So I would talk about it if it came up as a subject, but I don't tend to feel the need to bring up the subject, and there's often not a natural way of doing it unless we were going to have a social evening and all go out for a meal together. I tend to try and get out of the office to have lunch, just because I need the mental space. So it's like an open plan office with just bright lighting, and it's very busy and noisy, and I just think I need a bit of a break for my own mental health, if I can. So yeah, I don't know. I suspect a lot would be disapproving of the medical colleagues, because I tend to see them, they tend to focus on plant foods and vegan type meals from what I can see. And then there are our other colleagues within my team, so nursing staff, who haven't been particularly judgmental to my face. Some have been quite curious. But yeah, who knows what they're saying that I'm not privy to.
So what about friends, family?
Yeah, so my husband, he's pretty much carnivore now. He's probably about 90%, and otherwise keto. That took him a while. So he's a type 1 diabetic, and I'd been keto for a long time. And he knew what I was doing. I would talk about it a lot, but I would never try to force anything on him. And then just one day he turned around to me and said, I don't know why I'm doing this. I'm just going to go keto. So we used to prepare meals together, and then he would add in some rice or some other carb for his insulin with the main meal, and I just wouldn't have that stuff. So I felt incredibly happy the day he told me he was going to go keto, and then naturally that's kind of transitioned to being a very meat heavy keto diet. So he's very supportive. My mom doesn't really understand what I'm doing particularly. My son, I've got a 10-year-old son, he's really intrigued. So I speak to him a lot about nutrition. I would say he knows more about nutrition than the average 10-year-old. And there's some interesting conversations in the car when his friends are around. So I heard him recently talking about how you're going to get fat if you keep eating so many sweets, kind of thing, or that can make people fat. And then the friend was saying, oh, it's just about having a balanced diet. And I could feel myself cringing in the front seat, but I thought, I'm not going to influence anyone else's child. I just need to let them discuss it between themselves. So
yeah, you sound in the main reasonably supported. I mean, if your husband's there, I mean, that's the main thing. I think that really helps. So that's brilliant. I tend to do short, sharp interviews. Mm-hmm. So I just want to thank you for that. And if you're interested in mental health, then don't go away. Just look at this lovely video with Natalie E. West.